I'm so grateful you came for this. Left eye closes, coughing, throat closes up, shortness of breath. The whole left side of the body goes weak, can't stand, can hardly breathe. And this has been going on how long?
Last
11 years?
11, yeah.
11 years.
11
So
years.
you've had a lot of people look at this. And you're a physical therapist, a very
Yes.
gifted physical therapist. Okay, so this is what we found. Oh, and normally when she gets triggered, she'll be down for 4 days. So we actually did trigger her accidentally, just through the normal physical exam that we do. So when we had her hold her left arm out, which is what goes weak, the whole left side of her body goes weak. So holding the left arm out, she went weak, she was already weak, and that put her into a tailspin, and normally she'd be in bed for 4 days until she regained the ability to breathe well and could walk again. The good news is we were able to pull her out of that and within an hour make her to where it would have been like day three and a half. Okay, so we have proof of concept. We found, rang the doorbell of where it lives, and so here's what we know today. This is the main thing. So what we have is, I think, an acquired crookedness to the spine here. I think she was straight at one point, because you can see the acuteness of it, where it's really kind of bent right here at the cervical thoracic junction. Now, anybody can look at this and say, okay, the levator scapula muscles on the left side, look how low the left shoulder is. And anytime she uses her left shoulder, it puts her into her tailspin for several days. She knows she can't even use her left upper extremity. Okay, so I'm looking at this as I found two separate injuries. One, this injury that set her up. And when you start to look here, you can see how the upper cervical spine is kind of set up for injury. You can see the C2 is kind of forward on the left, and when we put her weight bearing, C2 slides forward on the left, C1 slides forward on the left. She has a vulnerability there. So just like, well, when it's crooked, you're going to have a binding, you're going to have a tightness, and in this case, the upper cervical is going to be vulnerable to certain movements. And she's been a little aggressive, young and strong and aggressive, and I think she sprained her ligaments up in here. So let's go here. So this is the way the anatomy is supposed to be. You can't lift your shoulders without having muscles that attach to this pillar here. So the neck, the muscles that attach to the neck make it so that you can lift your shoulders. I'll show you a picture of a suspension bridge, that's just how it happens. So whenever she uses the left upper extremity, she ends up pulling C1 and C2 out of place. And how did we get it to where she could breathe again and her eyes open? It was by adjusting C1, C2 for anteriority on the left and laterality on the left. So there she is, that's the scan with her lying down. There she is weight bearing. And I've got another picture of it here. So here you can see how spinous process swings way over to the left. Now it measures 16 degrees, but it's probably 13 degrees. I actually took this x-ray twice. I tried to get her to where her head was not rotated so I get a perfect measurement on there. But she has one eye smaller than the other. Not that you would notice, she's a beautiful woman, but there's asymmetries there that kind of have set her up for injury actually. So her spinous is to the left, and moving anterior on the left, the atlas is anterior on the left, and this is what kind of where we found it. When she rotates her head to the left, the atlas slides more forward on the left. Not a lot. I've seen them go, completely fall off. But when you compare it to the right, she looks pretty good with when she turns her head to the right. So that's how we knew, and we went after it. Oh, there's left and right head rotation. This green line is the midline of the foramen magnum. All right, so we're not getting into every possible structure. The sympathetic chain, the dentate ligaments that actually hold the cord that are being distracted and pulled in certain different directions. But here you can see how she slides off the midline of the foramen magnum with left head rotation And here, when she's right head rotation, she looks pretty much in the center. C2's in the center. C1 looks pretty good. When she's in left head rotation, it just kind of goes off of its axis there. And then we adjusted her with different vectors to find out what works best. When we went 40 degrees from the anterior, we only had to do that once, and then it seemed to swing it back around, and then we went 10 degrees anterior from the left, which is almost just a straight left to right, and that seemed to get her across the finish line to where she could breathe better. Now this is her weight bearing, leaning forward, like if she was brushing her teeth. We took a picture of her in that shot, and Atlas slides anterior. Yeah, I mean, we could talk about the muscles that are involved, getting pulled and under attention, how they connect from the neck to the shoulder. The omohyoid attaching to the shoulder. Yeah, there's the idea of the suspension bridge, the neck in the center, and then the muscles that would lift the shoulders. There's another beautiful picture of a good bridge. That's the mechanics of it. Any questions? Anything you want me to talk about?